Welcome to today's talk session. My name is Deidre Moss, and I'm the host of Can We Talk? I'm an educator, motivator, and a talk connoisseur. June is Men's Health Month, and we dedicated our session to talk about men's health and other related topics. We've invited Dr. Gregory Pinto. His office is Urology Care Bahamas at OakTree Medical Centre to help us dissect this topic. And as it pertains to Dr. Pinto's credential, he is a renowned Bahamian surgeon. He holds a degree in minimally invasive laparoscopic urological surgery from the University of Strasbourg, France. Dr. Pinto, please correct me if I get a little tongue twisted, okay?
No problem. You're doing well.
Thank you. He has experience working in South Africa, Germany, and France. He is a board-certified urologist and laparoscopic urological surgeon and a member of the European Association of Urology. After finishing his postgraduate fellowship in endourology with renowned German Kidney Stone Authority and thulium laser prostate pioneer, Professor Andres Gross. Dr. Pinto also completed fellowships with Professor Sanjay Kulkarni and surgical oncologist Salis Puntamapaker, both renowned in the field of urology surgery. Dr. Pinto also consults at Doctors Hospital and provides services to the Princess Margaret Hospital and Family Medicine Center. So at this time, I'd like to take a brief moment to thank Dr. Pinto's assistants, Whitney and Nikki. Thank you, Nikki. Thank you, Whitney, for helping to make this session possible. I'd like to thank you, Dr. Pinto, for taking the time out of your busy schedule to talk with us today. And although I've highlighted Dr. Pinto's credential, I would like to just pass the virtual mic to him if he'd like to briefly just give us a little glimpse into himself, if I didn't catch everything.
I think you got everything. Bahamian-born urologist, graduate of Queens College High School, and I think you got everything else.
Awesome. Thank you. Thank you, Dr. Pinto, for that introduction. So can we talk about men's health?
Yes.
Awesome. So before we begin, if you just joined us, like and share this video, subscribe to our YouTube channel using the links on our page. We need your support to continue these talks. Also, if there's something that you think we should be talking about, feel free to let us know. We want to hear from you. And with that, we will get into our session. So Dr. Pinto, can you tell us just a little bit about your background and what do you do?
Okay, urologist is a surgical subspecialty. It deals with men, women, children of varying ages, anything to do with the urogenital tract. I think we're best known for men's health, but we deal with women just as much as men. So any urinary issue, cancers related to the prostate, of course, the kidneys, the testicles, the bladder. We could even have penile cancer. Obviously, there are numerous benign conditions. For women, it may be urinary issues such as overactive bladder. Men and women, kids, kidney stones, urinary leakage, recurrent urinary tract infections. So there's a long list of things. There's a lot of overlap, particularly with women, with gynecologists in terms of the female genital system as well. If there's any organ prolapse, whether it's prolapse of the bladder or the urethra or the rectum, it also falls under the purview of gynecology and urology. So as a urologist, I can manage that as well. So primarily, I think we're known for anything to do with the prostate, and for men, obviously, we're the go-to when it comes to erectile dysfunction, which is a major issue for a lot of men. And it's a taboo topic, unfortunately, that caused a lot of men to suffer in silence and needlessly for many years.
Thank you, Dr. Pinto. Thank you so much for sharing that. And I learned a little bit today because in my mind, I was just thinking about the male side. I didn't know that you touch also a little bit on the women's side as well. So
a lot. So
yeah,
everything to do with the urological system of women, yes, we deal with it.
Thank you for sharing that, and also sharing that for a lot of men, they suffer in silence I guess.
A lot of men's.
Yeah, it's not something that you want to talk about when it as it pertains to erectile dysfunction. But we're going to talk a little bit about that. But I want to ask you about the importance of highlighting men's health and men's health issues. And why is it so important? Why is the month of June so important to highlight men's health?
Well, it's important to highlight men's health every month and all the time, perpetually. But obviously, it's a great idea to at least one of the 12 months to try and concentrate and get the attention of not just men, but their loved ones, their colleagues, so that men are notoriously terrible at caring for themselves. Even the best of us will care about our loved ones before ourselves, and many times we neglect our own health. And in the end, we have to love ourselves just as we love our loved ones, and we have to also look at our loved ones. If we're not in good health, how are we going to take care of them? How are we going to love them? How are we going to see our grandchildren graduate from college or get married or enjoy those golden years with our wife? So not only do we want to have longevity in terms of years on this earth, but we want to have good quality of years on this earth. And we don't want to go from being the primary breadwinner or one of the primary breadwinners of a family where we have numerous persons in a family relying on us financially, emotionally, psychologically, etc., being the bedrock of the family, to then within weeks or months becoming basically a burden to your family economically and emotionally. Otherwise, if we're struck down with, in many cases, non-communicable diseases that could have been prevented or managed effectively without horrible consequences. So I'll highlight prostate cancer. Prostate cancer is the number one cancer in this country. When we talk about men and women, breast cancer is second. Number one is prostate cancer. 1 in 6 to 1 in 7 men are going to get prostate cancer in their lifetime. But prostate cancer is probably the easiest cancer of all cancers to treat effectively, where at 5-year mark, the cancer-specific survival is about 100% if we catch it early. Early diagnosis is key for any cancer, but prostate cancer in particular. 10-year survival could be as high as 98, 99%. But why are over 100 men in this country dying needlessly of prostate cancer? It's a tragedy. And most of these deaths are preventable. And it's not just a pleasant death, it's a protracted, prolonged death where you may die of something such as kidney failure. You may end up with having paraparesis, paraplegia, where your spine is riddled with metastatic disease. So it's not a pleasant death. It can be quite a long death. It's an expensive death, and it's a needless death. So all we got to do is be very diligent in picking up prostate cancer, because we have all the risk factors in our society for a more aggressive form of prostate cancer and a very high incidence of prostate cancer. And that includes such as being of African ancestry. That's the second greatest risk factor for getting prostate cancer, being of African ancestry. So that basically describes most of the men in our society. The next, the number one risk factor is advancing age. So prostate cancer is a disease of older men. Of course, you can have, because of genetic predisposition or other conditions, you can rarely have cases where you can have prostate cancer in your 30s or 40s. But for the most part, the average man is going to get prostate cancer at 64, 66, 67. But if we can pick it up early with just a simple blood test, prostate-specific antigen blood test to start as part of your surveillance every single year, starting at the age of 40, we have an excellent chance of picking up prostate cancer when it's very low volume, early disease, and possibly even clinically insignificant, where we don't even necessarily need to cure you right away. If we can pick up prostate cancer so early, we can watch you for many years, actively surveilling you, maybe 8, 10, 12 years before the disease becomes clinically significant, and then we can easily cure you. And there are many ways that we can cure prostate cancer, minimally invasively, with little to no recovery, and you have an excellent cure rate. And you basically, instead of dying needlessly, you can have an extra 25 years on this earth.
Dr. Pinto, you mentioned some alarming statistics as it especially as it pertains to our country. And with those alarming statistics and, men dying from prostate cancer, I just want to ask, how can we connect the dots? Because you mentioned that this is something that is easily preventable, easily treated. So how do we go? How do we connect those dots?
I think if men were to realize that a diagnosis of prostate cancer is not a death sentence, and it's a small little bump on the road that you can easily overcome. We can do minimally invasive procedures on a weekend. You could be back to work early that next week, and you have minimal to no symptoms afterwards. You have an excellent cure rate with minimal to no recovery. Men just need to know that you need to get an annual physical every year. All you need to do in terms of looking for prostate cancer surveillance is it's an extra tick on a lab form that your physician is going to fill out. And all we want to know is your baseline prostate-specific antigen blood test. If it's abnormal or there's a great increase from 1 year to the next, there are more specific blood tests that we can do. There's a urine RNA test that's actually available that can pick up prostate cancer even years before it becomes of any clinical significance. And it can determine with a high certainty whether, even if you're going to get prostate cancer, if it's low risk or high risk disease. So if we pick up prostate cancer early, it's, as I said, it's just a little bump in the road, and you could be cured on the weekend, and you can go on and have another 25, 30 years on this earth. But needlessly, over 100 men are dying a very regrettable and sad death.
Yeah, those statistics are alarming. And when you talk about the fact that we're living in a country where we have those risk factors as it pertains to African ancestry and those age factors, there's certainly a reason why men need to get on it in terms of following up and getting those health screenings. And so I want to thank you for mentioning that. Sometimes I'm not a man, but in watching men and observing, men tend to be a little bit more lax in terms of the health department. And I hope that there's some work to be done. And so major health concerns, what are some of the major health concerns for men, and what should men be concerned about?
Well, we want to have a healthy lifestyle, and this starts, obviously I mentioned the age of 40 when we start prostate cancer screening, but good health needs to start even in infancy in terms of learned behaviors, in terms of having a healthy, well-rounded diet, in terms of getting exercise, something you love to do 3-4 times a week, maintaining a normal body mass index. We need to combat childhood obesity. So not just boys, but girls as well. We need to make sure that they're not obese, even when they're preteens or even younger. They're not going to be predisposed to childhood diabetes, hypertension. They're not put on the road to developing heart disease later in life, issues with obstructive sleep apnea, et cetera, et cetera. So we need to start from early, and that just have to start with the whole paradigm needs to change in terms of, as a nation, we need to eat healthier. Obviously, a lot of it has to do with economics. It's, fruits and vegetables, healthy food, in many cases, unfortunately, is more expensive than fast food or unhealthy food. But if we can start with healthy foods, cut out the sodas, cut out the sweets, make sure that we get exercise, make sure that even as a child, we're getting wellness checks, make sure that every child has a pediatrician that follows them. And if there's any, particularly for men know their bodies. If something's going wrong, they need to seek medical advice. They're not, why wait and let something linger for years, and something that could have easily been treated when it's with the onset of the symptoms has gone on for many years and caused untold harm to many organs of the body that in many cases is irreversible. We look at how many hundreds of persons, even young persons, are on dialysis. Many of them, it's because of diabetes or hypertension or non-communicable other diseases that could have been treated effectively if they had just gotten an annual physical once a year. If you're a diabetic, you might need to see a physician every 4 months. Just because you're a diabetic and you're taking your medication doesn't mean that that's the same medication you need to be on for the rest of your life. Circumstances change. You might need to be on a different dose. Might need to be on a lower dose, a higher dose. You might need to be on another medication or another class of medication. So just seeing a doctor once, even if you are diagnosed with hypertension or diabetes and taking the same medications, and many men in particular don't even know the medications they're taking, much less the doses that they're taking, but without getting surveillance to see if the medication is working. It might work for the first 2 years, and then you might need to be on something different. So you need to be surveilled religiously, and we need to be very diligent in terms of picking up non-communicable diseases early in life, and even in terms of combating childhood obesity to prevent many men and women from developing hypertension, diabetes, or obesity.
Thank you. Thank you. Thank you for sharing that. And so we come to health advice for men, especially for men of different ages. And, what health advice would you offer to men as we look at, men in different age groups?
Well, I did mention, obviously, lifestyle. You want to make sure you get at least 7 hours of good sleep. You want to make sure that too many men in our society, unfortunately, socially, are smoking cigarettes or cigars. The profound negative impact of nicotine, whether it's cigars or cigarettes, in terms of cardiovascular system, your heart, your blood vessels, your risk of multiple cancers. And not only that, you have to look at secondhand smoke. Even if you have a pregnant wife or a pregnant niece or someone in your family who has a child, that could do untold harm, irreversible damage to unborn fetus. So you got to live your life thinking of those around you. We talk a lot about physical health, but I think we also don't put enough emphasis on emotional, mental, psychological well-being as well. Particularly, we look at the tragedies that our country has faced in terms of Dorian, the post-traumatic stress disorder of it all, that many who went through it lost loved ones, lost everything they had in the world, had to be uprooted, start all over again. The issue of the COVID-19 pandemic, so many persons in our society have had the brushes of death themselves going through COVID-19, or they've seen a cousin, an uncle, a father, a child dying of COVID-19. That in itself, a lot of people don't have enough outlet in terms of trying to get stress relief, trying to get a support to try to get through that tragedy itself. And that in itself, a lot of men self-medicate essentially. They'll go to alcoholism, they'll go to unhealthy habits to try to go in terms of overeating as well, to try to cope with the stress that they're going on through in their life. I mean, many persons now, it's difficult to even know where their next meal is coming from, how they're going to pay for gas, how they're going to pay their rent, their mortgage, and they have a lot of persons relying on them. So we need to talk about emotional well-being. We need to seek help, whether you're having stress, if you're having depression, if you're having anxiety, if you're having suicidal ideations. You need to understand that a lot of people are going through the same thing. There's no harm in seeking advice. There's no shame in it. Anytime you seek help from a psychologist, a psychiatrist, a counselor, your primary care physician, or even a urologist, everything is done within the confines of confidentiality. So you can open up to your physician, you can open up to your nurse, to anyone, that, even in your family members. It's important to vocalize what you're going through. It's not something that you need to go through alone. Everybody has someone who loves them. And as a group, we need to try to get people through tough times.
Thank you, Dr. Pinto, for elaborating on that, in that it's not just, the physical health, but also mental, emotional, social well-being that all kind of come together to make us a holistic person. So I want to thank you for sharing that. And you touched a little bit earlier about prostate cancer and the prevalence of prostate cancer in the Bahamas being number one, right?
It's the number one cancer, and per capita, we have the 14th highest incidence in the world. Jamaica has the 4th highest incidence in the world. So
Wow.
when we talk about African ancestry and its impact, incidence of prostate cancer in United Kingdom, 1 in 4 men of African or Caribbean ancestry are going to have prostate cancer.
Wow.
In the United States, 1 in 6 African American men are going to get prostate cancer in their lifetime. We look at the genetic predisposition. If you have a first-degree relative, a brother, a father who's being struck with prostate cancer, particularly at the less than the age of 50, you're at a much greater risk of getting prostate cancer. You have at least a 15% greater risk if you have a first-degree relative who's had prostate cancer. We look at conditions such as the breast cancer gene, BRCA gene. A lot of men don't understand that men and women can get that gene mutation, BRCA gene 1 and BRCA gene 2 mutation. If you have a family history of breast cancer, of prostate cancer, it even predisposes you to pancreatic cancer, skin cancer, multiple cancers. If you have BRCA gene 2 mutation as a man, your chance of getting prostate cancer is 8 times greater than if you don't. So you're almost destined to get prostate cancer. So these are the individuals where we need to be extremely diligent in picking up prostate cancer so that when they unfortunately, inevitably, in many cases, get prostate cancer, we can cure them. And it can, as I said, be a little small bump on the road. If you have the BRCA gene type 1 mutation as a man, your chance of getting prostate cancer is 3 times greater than if you don't. If you're obese, you have a more aggressive form of prostate cancer. So we check all the boxes. We're an obese nation. We are living longer, so we have more men who have advanced age. We're primarily of African ancestry. We have a very high incidence of BRCA gene mutation that you can see the effects of that, where we have so many women, even very young women, in the prime of their lives being struck with even stage 3, stage 4 breast cancer. So because we have so many risk factors, that's the bad news. We're at very high risk of getting prostate cancer. But the good news is we have so many ways of picking up prostate cancer early. There's so many ways that we can cure prostate cancer. You don't even necessarily need surgery. And you can have almost 100% cure rate if we can pick it up when it's early disease, low volume disease, confined to the prostate.
So can you just talk about the BRCA gene mutation for persons who may not be as familiar, with what it is?
Okay, so when you get the mutation, it's going to affect in terms of cell replication. So every cell in our body is going to die, and there's going to be replication of new cells. But when we have genes code us and tell us which cells are going to basically program the cells. When there's a mutation, it allows for abnormal cell proliferation and growth. And that's where we get into cancer. The mutation can basically be thought of as there being, if you have the normal BRCA gene, you can have, it's basically like a suppressor gene. It helps prevent you from getting breast cancer. But if you have the mutation, you don't have that mechanism to prevent getting breast cancer, prevent getting prostate cancer. And men can also get breast cancer. So that is something that a lot of people don't know. So I always speak that knowledge is key. If you understand that a disease, if you understand how to pick it up, if you understand how it can be cured, then you're not going to have this great fear. And you're not going to live, and a lot of men love to live in ignorance. They'll say, when it's my time, it's my time. But why are there so many men dying needlessly in their 50s?
Yeah.
When they have so many years potentially ahead of them. And it's a tragedy.
It is a tragedy. We want to prevent that by sharing information. You don't have to die needlessly. As Dr. Pinto has said, it is something that is easily preventable if you catch it early. And so in moving to our Fast Talk segment, we're coming near to the end of the session. We've arrived at our Fast Talk segment. We're going to give you 60 seconds, doctor, to answer each question. So do you think men are afraid to consult with physicians on their health issues, and why?
I think they like to live in ignorance. They don't want to admit something's wrong. They don't want to see that they have any weakness. A lot of men, they live in fear of the unknown, even basically afraid of needles. They're afraid of going in the hospital. They're afraid of getting bad news. But for many men, let's just look at motivating factors. If you have hypertension, it's known to be a silent killer. It may not manifest in terms of having serious health complications until later in life, although I know many patients in their 20s and the 30s on dialysis because they didn't realize that they had high blood pressure. There are hundreds of young kids, little boys and little girls who have diabetes, who are overweight. So it's never too early to try to educate parents, educate patients directly, and let's get over this fear. If you're afraid to go see a doctor, then come with your wife, come with your granddaughter. When it comes to the exam, they can step outside. When there are any embarrassing questions, or do you want to relay anything to do with erectile dysfunction, for that part, they can step outside, but at least they got you in the office, motivated you to try to seek some help. You don't have to go on your own. If you leave it to a man, they'll procrastinate forever. Men are procrastinators. But if they're going to procrastinate 5 years, and maybe they saw a doctor 5 years ago, in that intervening 5 years, a lot can happen and a lot of irreversible damage can be done. So you have to seek help every year.
Thank you. And do you think Bahamian men and men in general do a good job of maintaining their health?
Oh, Bahamian men are terrible. I mean, we're an unhealthy nation. We're an obese nation. We have high rates of hypertension, diabetes, heart disease. Far too many men die a very early death or have complications related to the same. So erectile dysfunction in many ways is an early warning sign of something more sinister going on. That might be an early warning sign of early heart disease. It may be a warning sign of plaque formation or atherosclerosis within small blood vessels that supply your male member. So if you're going to have blockage of your arteries, obviously it's common sense that the smaller arteries are going to be blocked before the bigger arteries. Which are the smaller arteries? Those are the ones that supply your male member. So if you don't have a good blood supply to your penis, erectile dysfunction is going to be ruining your life. But if we can pick that up early, we can hopefully reverse those changes, prevent you from getting obstruction of larger blood vessels, such as the coronary arteries that supply the heart, preventing you from getting a heart attack, myocardial infarction 10 years, 15, 20 years down the road, prevent you from getting a stroke from obstruction of your carotid larger arteries 20 years down the road, and get you on track for a healthier outlook in life.
Awesome. How often should a man visit a physician or get regular health screenings?
So you mentioned a man. We want to start from childhood. You want to have boys coming in and obviously getting vaccinated. You want to make sure that if there's any issue, whether you're 6 years old or you're 8 years old or 12 years old, that your parents are going to seek or instill in that young man that they need to seek medical consult if anything goes wrong. So stop trying to be a Google doctor and try to diagnose yourself and taking unregulated medication or borrowing medication, which is exceedingly dangerous, from your cousin or your neighbor or your church member. Seek help, and every individual should be treated as an individual just because you have similar symptoms of condition, even erectile dysfunction. There can be more than a dozen different causes of that erectile dysfunction. So the erectile dysfunction that your neighbor might be suffering from, the root cause might be very different from the one that you're suffering from. So even for erectile dysfunction, we don't want to just treat the root cause. I mean, the symptoms, you want to treat the root cause. Obviously, that root cause is going to cause irreversible damage, make your early erectile dysfunction profound and long lasting. You want to make sure it doesn't cause damage to other organs, including your kidneys, your eyes, your heart, your liver, etc. So always listen to your body. As a man, if you're waking up 5 times in the night, you know something's wrong. If you know that you can't make it to the next bathroom because you're going to leak urine, you know something's wrong. So if something's wrong, and stop suffering in silence. There's so many ways that we can get you back on track. Urology, modern urology, is basically minimally invasive. There's so many medications that can get you back on track. Boys and girls should not be wetting the bed. There are too many young persons, preteens, teens, who've been wetting the bed 8, 10, 12 years. Imagine the psychological impact on them when their personalities are being formed of wetting the bed, them blaming themselves, family members blaming them. They may have a sibling who's 5 years old and they're 15. They're wetting the bed and their sibling's not. They can't go on field trips because of that great, terrible secret of wetting the bed. And it's not their fault. We can, as a urologist, determine why you're wetting the bed. In many cases, it's called primary nocturnal enuresis. We can put you on a medication that gets you dry that very night. So stop wetting the bed. Stop having sleepless nights and going to school fatigued and letting it affect your academics and affecting your development and your personality, causing depression and anxiety for not just a child, but parents as well. Changing bed sheets all the time, kids smelling like urine all the time. Such things, and there's so many other conditions that don't have to exist and can be prevented or treated very effectively.
Thank you. Thank you for mentioning that. And also, what one advice would you give to men to help improve their health? What's one advice you would give?
Well, obviously, you want to have a healthy outlook in life, and that in terms of you want to make sure that emotionally you have good well-being, that you're not, if you have issues with anxiety or depression, that you seek help, that you don't try to deal with everything on your own. Obviously, you want to eat healthy. And there's so many ways that you can learn to eat healthy. You might not know what is the right thing to eat or not eat. They're nutritionists. As medical practitioners, we can put you on the right track, what to eat and not to eat. As I said, this should start younger in life. Parents should know what to feed their kids. So if there's anything that I would like to impart is don't be afraid of the unknown. Knowledge is key. If we can pick up almost every disease early, you have an excellent cure rate. We can manage it. It doesn't have to affect your health. You don't have to, there are men in their 40s, 30s, blind because they had diabetes and hypertension that they never dealt with. Why do you have to live your life blind? Why do you have to live your life without an erection? Because when it started to happen, you ignored it and you tried to self-medicate, or you lived your life in a shell, closed off from society, from your loved ones. So if something's happening, and if you are diagnosed with a condition, stop living in ignorance and think that, okay, I lost a little bit of weight. I cut sugar out of my diet. If you have an issue with the pancreas and insulin resistance, yes, having a healthy lifestyle, getting exercise, watching your diet is going to help you control that diabetes. But in many cases, you have essential hypertension, for example, you have to be on medication. Stop with this. If you can take one pill a day to, as a man, this is a motivating factor, keep your erections, prevent you from going to the hospital. If you don't want to see a doctor for 25 minutes, do you want to be in and out of the hospital for the rest of your life? Getting stuck with needles, requiring surgery, having an infected diabetic foot, requiring surgery on your eyes because of diabetic retinopathy, having diabetes leads you to have kidney failure where you're on dialysis 3 times a week. There's so many things that could be prevented. I want to be proactive. We need to just stop the mindset that we need to treat conditions when they happen. Let's be proactive and prevent many of these conditions from happening.
Thank you. Thank you for sharing that. And is there any additional comments that you would like to add? Anything you felt that you missed or you want to share?
Well, I think that a lot of men in this country, there's a very high incidence of obesity. There's so many conditions related to obesity. That includes hypertension, that includes diabetes, that includes high cholesterol. As you enter middle age, you also have a condition called metabolic syndrome, where even if you had diabetes or hypertension or high cholesterol, it's more difficult to control, or you may have late onset of one of these conditions. If you have obesity, there's a high link, a bidirectional link between obesity and low testosterone. If you have low testosterone, it's going to negatively impact your erections. If you have low testosterone, you're going to put you at risk of developing obstructive sleep apnea, where you're not going to get quality sleep. You're not going to get the REM sleep, rapid eye movement sleep, when we dream. And that's also the time in the night when the testosterone that men use up throughout the day is replenished. So every single night, you're not getting a good night's sleep because of obstructive sleep apnea brought on by your obesity, etc. Imagine the issues that are going to happen in terms of your testosterone is low, you're going to be fatigued. You're not getting a good quality sleep, you're going to be fatigued. You're going to feel run down because you're obese. The obesity is made worse by the low testosterone. The low testosterone causes obstructive sleep apnea to get worse. The obstructive sleep apnea is going to make the low testosterone to get even worse, which in turn is going to make the obesity worse. So a lot of men don't even understand that there's an entity such as testosterone. So it's always important, and I'll always do it starting at the age of 40, at least get a baseline of not just your total testosterone, but your free testosterone level, because every year starting at the age of 40, your testosterone level is going to fall at least 1 to 2% every year. Some men are going to drop more drastically because of predisposing conditions such as obesity or obstructive sleep apnea, or they may have started at a very low level to begin with, and any drop is going to cause them to be very symptomatic.
Thank you. Thank you for sharing that information and how obesity is connected to those other conditions as well. And so maintaining a level of health is very important. So I want to thank you, Doctor, for taking the time out of your schedule to share with us today. And it's so profound. Men have so many issues to touch: erectile dysfunction, prostate cancers, so many different things, and we do not have all the time to do it in one session. But I want to thank you for taking the time out sharing with us today.
I appreciate the invite.
Thank you. You're always welcome. You know, to talk about these issues is very, very important. Thank you. I would like to thank our viewers for listening in. Like our page for future notifications of upcoming talks. Comment under this video. Let us know your thoughts. Let us know what you want us to talk about. You can also subscribe to our YouTube channel, Can We Talk? Follow us on Instagram, Twitter, and all the social handles provided on our page. And remember, let's think, talk, do. Thank you so much.
Thank you.